So why is evidence-based nutrition so important, Jatin, for both us as clinical professionals and for the public?
Well, when I'm talking about for professionals, as I've said, with EBN, it provides a structured approach to interpreting the evidence. And this ensures that our recommendations are not just based on anecdotal experiences or trends that might be occurring, but on robust, systematically evaluated scientific research. And this not only helps the patients achieve better health outcomes in the long term, but also fosters a level of trust that they would have on the dietary advice that we tend to give them. And for the general public, what evidence-based nutrition does, it helps cut through diet trends and misinformation and empowers the individuals themselves to make healthier choices confidently. When people understand that nutritional recommendations are grounded in scientific, systematic research, then passing fads, they're more likely to follow through and achieve better long-term health outcomes for themselves.
And does this also lend to greater public health initiatives?
Yeah, absolutely. On a population level, evidence-based nutrition underpins many public health initiatives and nutritional guidelines worldwide. There are many programs out there that are designed to reduce salt intake or sugar intake. Now, these things aren't just random or arbitrary that someone has decided, hey, let's stop people eating salt or sugar. They stem from extensive evidence, usually talking about dozens to hundreds of papers and citations where they're seeing that evidence, analyzing it, appraising it, and then linking, for example, that excess sodium to things like hypertension and cardiovascular disease. And because they're evidence-based, these public health interventions can help drive policy like they do in both the US and the UK, like clearer food labeling or industry-wide reformulations to lead to an improvement in population health.
And would you say that this encourages critical thinking?
Yes, and I think evidence-based nutrition at its essence is about critical thinking. It's about taking any kind of advice, looking deeper into it, focusing on it, appraising it, and then seeing whether it fits that population, that person, and whether they're able to gain any benefit from it. Because going back to what you mentioned before, there's no point having the greatest intervention in the world. If it's not right for someone, they won't be able to use it.